Hello everyone. I am Dr. Berk. We continue with medicine treatment in erectile dysfunction. I will not talk about them here, as we explained their mechanism of action in the previous video. I will try to give more practical information. As you know, there are many medicines on the market. But no matter what medicine you use, one of these three active ingredients must be in those medicines. The first is sildenafil, which celebrated its 20th anniversary this year. The oldest medicine. The second is vardenafil. The third is tadalafil. There is no difference between these medicines in terms of potency or mechanism of action. So what's the difference then? There are a few minor differences. I'll talk about them. One is the duration of the effect. The sildenafil and vardenafil group are effective for about 6 to 10 hours, and the tadalafil group is effective for 36 hours. Secondly, as we have seen in terms of dose, sildenafil reveals its maximum effect at 100 mg, while vardenafil and tadalafil are at 20 mg. So their doses are slightly lower. In addition, these medicines are taken as tablets before intercourse. Only the Geligra, which is the trade name of sildenafil, can be taken by suction or in gel form. Another situation is that you can use the 5 mg dose of tadalafil every day regardless of sexual intercourse. While all other medicines are taken before sexual intercourse, tadalafil 5 mg can also be effective when used every day, regardless of sexual intercourse. One of the most important issues for us is what happens when we take these medicines. What doesn't happen when we take these medicines is that our sexual desire and desire increase. In other words, technically, when you take the medicine, if you do not have sexual desire and desire or if there is no sexual stimulus, the medicines do not work. This is quite important. Well, we took these medicines. How effective is it? Studies show that the overall effectiveness of medicines is 70%. If people with diseases such as diabetics and blood pressure patients have a serious erectile dysfunction, the rate can decrease to 50% or even 30%. Who should not use it? Those who have not been treated for the heart, especially those with cardiovascular disease and heart rhythm disorders, should not use these medicines. So I had a heart attack, I had a bypass, I'm doing well now, can I use this medicine? Yes, you can. In other words, treated cardiovascular patients can use these medicines. Side effects are another important issue. They have many side effects, such as headache, blurred vision, muscle aches. However, this is a situation that varies from patient to patient. Sometimes it can vary from medicine to medicine. So the patient takes sildenafil 100 mg, there are no side effects. When you take vardenafil 20 mg, all the side effects can occur. We are trying to learn this through a little trial and training. One of the biggest mistakes made now is the dose. The dose adjustment is done quite incorrectly. Because it is not done by a doctor, very serious mistakes can be made because it is done by a co-dose. The first is the unnecessary overdose. In other words, if you do not have a lot of erection problems, if you have a slight erection problem, you should not go and use the highest dose directly. My advice is that regardless of your erection level, you should start with the lowest dose at the beginning and increase the dose unless it is enough. Another situation is the division of the dose, that is, the use of medicines by breaking, which is a very important issue. Let me explain this very briefly. You have a notched 100 mg of ELAs in your hand, which you cut in half. You get 50 mg in your right hand and 50 mg in your left hand. However, if there is no notch in the medicine, when you cut it in half, it can go to a strange level of 90 mg in one hand and 10 mg in the other. Therefore, the medicine has an effect and does not have an effect. This is also important. Therefore, my advice is that if there is no notch in the middle of the medicine, please do not use the medicines by dividing them. Another condition is its use with alcohol and food. We do not recommend using it with alcohol and with food just before food, that is, just before and immediately after eating, because it can increase or decrease its effects and increase the appearance of side effects. For this reason, please do not use alcohol in just before and after meals. As a result, it is best to have medicine treatment prescribed by a doctor. I advise you to use the appropriate medication, the appropriate dose of ELAs, at the appropriate time and in the appropriate way. In our next video, we will continue with shock wave therapy for the penis, which has been applied for 3 to 4 years in Turkey and is becoming increasingly common, a very new treatment such as shock wave therapy for erectile dysfunction. Thank you.